Following the rising death attributed to the deadly Ebola virus in several West African countries, the Ministry of Health has issued an alert to Ugandans to watch for any Ebola cases across the country. The warning comes 2 days after a Ugandan doctor, Muhumuza Mutooro, succumbed to Ebola while in the line of duty in Liberia. The ministry says the doctor's death has caused panic among Ugandans, with fear that the outbreak in Liberia, Guinea and Sierra Leone could spill over to Uganda. The ministry is warning Ugandans to limit travel to the Ebola-affected West African countries.
Unless, of course, it's an emergency or something very, very important. However, there are no travel bans to the affected countries. In the case of any travels, you are advised to observe the precautionary measures instituted by the respective countries. Those with relatives living in the affected countries should keep on the alert in case their relatives return to the country during this period.
According to the World Health Organization, at least 467 people have died of Ebola as at 30th June out of the 759 cases of the disease reported across the affected countries. Medical experts say the West African Ebola strain is highly infectious compared to the strain that have previously hit Uganda.
Most from the way it is spreading and killing, most likely it is Ebola Zaire.
Uganda has suffered at least 3 Ebola outbreaks in the last 14 years in 2000, 2007 and 2012. The outbreaks claimed 2 doctors, Dr. Matthew Rukwiya in 2000 and Dr. John Akure in 2007. Because of Uganda's experience in containing the disease, a team of experts led by State Minister for General Duties in the Ministry of Health, Dr. Tumwesige, has left for Accra, Ghana to work with the West African teams to contain the epidemic.
Uganda has gained experience, has gained expertise, and has gained capacity to diagnose the disease. In the past, Uganda would send specimens to Centers for Disease Control in Atlanta, Georgia, United States of America.
Ebola kills in a short period, but the experts say it can be easily prevented. The disease manifests through high fever, vomiting, diarrhea, abnormal pain, headache, red eyes, and sometimes bleeding from the body openings.
There is an interaction, possible an interaction with animals, but we have not definitely found out that Ebola is harbored by this and that. But there is a close association with bats, fruit-eating bats, and people who get exposed to monkey meat.
Though no case has been reported in Uganda, the ministry has intensified surveillance checks at the border posts and the airport to detect potential suspects from the affected countries. Jjingo Francis, NTV.